Well, a genetic counselor is a specially trained medical professional whose function is in the cancer realm, is to try to help individuals and families clarify what their risks for cancers are. In light of those risks, in partnering with their physicians to try to get a plan in place, a management plan that fits that individualized risk. And if genetic testing is indicated to help in that regard, to help them make an informed decision about genetic testing. Those tests are complex, the results are sometimes difficult to understand, and we are especially trained to help both the physician and the patient understand the ramifications of a test result as well as the limits of the test and what it means for them and their families. A man or woman who's been diagnosed with cancer, they sometimes will say, why do I need to see a person in genetics? I have cancer, what difference does it make to me? Or I might not have kids. Well, if we can figure out the underlying reason for the cancer, and if there's a reason to suspect it might have a genetic piece to it or an inherited piece to it, it may help their physicians choose a better treatment, but it also may give us guidance as to how to best screen them to perhaps prevent another cancer from occurring or diagnose it early. For an individual who's got a family history of breast cancer, they're often very concerned. What's the chance this is going to happen to me? Should I get a genetic test? Will that tell me? And the genetic counselor is in a perfect position to help assess the risk. For some of our colon cancer patients, we need to start them at 20 instead of 50 and maybe do them every year instead of every 5 or 10 years. So we want to make sure that the right people are screened and that people who don't need to be don't have excessive screenings. We haven't found all the genes that cause cancer yet. So genetic counseling does not always equal genetic testing. People can be high risk even if they've had a normal gene test. So genetic counseling is about clarifying risks and making informed choices. Virginia Piper had really started the forefront of promoting genetics as a component of cancer services. We try across the whole system of Virginia Piper Cancer Institute to be sure that the physicians and the nurse coordinators and every cancer patient at Virginia Piper Cancer Institute should have a nurse coordinator help guide their care, is aware of the little ticklers of what is it about a patient's personal diagnosis or family history says they may benefit from seeing a genetic counselor. We've done a really good job at the Virginia Piper Cancer Institute of having genetics a part of all the tumor conferences, and so when issues come up that we can remind the providers that this needs to be thought of, and so that the patient and their family is aware that this service is available. We have genetic counselors at all the major metro hospitals. We also have it at some regional hospitals. And because access is so important and we want to be sure people do have access, we've begun a telehealth genetic counseling to some of the outstate regions so that people can stay in their own communities and get this service. It's about screening, prevention. It'd be great to put oncologists out of business. I think that would be great.